So our next speaker is Dr. Tariq Reza Ali. He will be talking on compliance to post-injection follow-up and laser in ROP babies and global data and experience in Bangladesh. Thank you, sir.
Greetings from Dhaka, and we are really happy to be here, and I can see Dr. Srinivas is here, and always we see him, he's explaining his topic in a big conferences, and now we can see him sitting with us. We are really very happy to Dr. Srinivas to get you here. My topic is compliance to post-injection and post-laser follow-up in ROP babies. What do we mean by compliance? Compliance refers to the extent to which a person's behavior follows medical advice or corresponds with recommendations from the healthcare provider. And medication compliance means a degree or extent of conformity to the recommendations about day-to-day treatment by the provider with respect to the timing, doses, and frequency. Reversibly, if I tell that what are the factors which are barriers to the effective use of medicines, this includes poor provider-patient communication, inadequate knowledge about a drug, not being convinced of the need for treatment, and fear of adverse effects of the drug, and long-term drug regimens, and complex regimens that require numerous medications with varying doses. With this in mind, we wanted to do one retrospective study at our Bangabandhu Sheikh Mujib Medical University at Dhaka, 2021 to 2023, when all babies who needed treatment, we compiled the data from them. What we found that around out of 31% was type 1 ROP, and who needed 13% needed injection, and near about equal number needed laser. 4.52% needed rescue laser, and surgical intervention was needed in about 3% of cases. And the indications were that you see aggressive ROP was 130 patients, and this compliance about 42% of all the patients of type 1 ROP, and surgical need was 4.6% and 5.4% patients. Mean gestational age was 33 weeks, and mean birth weight was 1795 gram. The compliance to treatment, what is our topic is, you see 100% of the babies whom we advised for injection, they came for injection. And 90% of the babies requiring laser underwent the procedure. The follow-up, first day or second day follow-up was 100% injection anti-VEGF, and 1 week follow-up was 97%, 2 week follow-up for 64%, in 4th week it went again up to 91%, and then it declined by 85 in 8th week, 61 in 12th week, and 16th week 31% only. Follow-up schedule for laser, first week follow-up was 97%, second week was 100%, 4th week it declined to 65, and then slowly declined to 8th and 12th week. Rescue laser was needed in 43 patients. Do you think that this is a success? Yes, I feel this is a success. Why this is success? That is, the behind is establishment of ROP center by Bangabandhu Sheikh Mujib Medical University with collaboration with Orbis. And we procured one Trinetra in 2022. And you see the authority of Bangabandhu University, they are working with us. They are very happy to share their space and everything with us. So documentation and learning of the parents about the severity of the disease has been increased. Proper counseling was done by optometrists and our residents, and contact with the parents over mobile phone, and communication with other family members was needed. And another thing is, you see, treatment cost is very minimum in our center, only taka 3,000, which is near about 2,000 for injection, 2,000 INR for injection anti-VEGF, and taka 6,000 for laser. And retina specialists, neonatologists, and caregivers, we talked in the same pace, and dramatic improvement of the transportation in Dhaka city, probably it caused this success. Comparison with published literature, actually no such data I could get, but you see, this is a data from Anand Vinekar. He showed that factors influence the ideal timing of laser intervention. 7 factors he pointed out. The last one is follow-up compliance. And what he did, he scheduled for weekly imaging until a postmenstrual age of 44 weeks, and fortnightly until 52 weeks, and monthly thereafter, and then yearly for examination under anesthesia. This is another study from South India, a recent study. They showed that only 5 of the 14 individuals completed the 6 months of regular follow-up after laser. And high rates of loss to follow-up have been reported from other centers in South India. This is a very old study. You see retinopathy of prematurity in Hong Kong, the majority of infants, they screened, this is not treatment. On screening was 99% they could get all the babies to under screening. This is a very old article. They divided their patients in category 1 less than 1,000 gram, category 2 more than 1,000 to 1,250, category 3 1,250 to 1,750, and category 4 1,752 and more. They showed that category 1 and 2, they are very compliant to the treatment and compliant to the follow-up, but category 3 and 4, they were not much compliant. This is another study from India only, that improving the follow-up of infants. It is a very well-read article from Anand Vinekar. They showed the reasons pertaining to travel and logistics and those related to awareness. These are the main 2 factors for reasons of dropout of the babies. This is another article by Mangat Dogra and Anand Vinekar. This is my last article I want to show you, that anti-VEGF, what we are using every day in our day-to-day practice for aggressive ROP babies. They showed that this follow-up of infants is needed 48 to 72 hours after injection anti-VEGF to assess the complications and recheck every 1 to 2 weeks. And fluorescein angiogram is recommended for all treated patients by 60 to 65 weeks, they advised. And however, angiography is not readily available in other centers like us. So the specialist may rely on clinical examination, they told. So our limitations is we have no provision of FFA in our center, as I told, and follow-up we didn't do after 3 months. Probably we have to increase this follow-up. And refractive error correction at the age of 6 months we are doing, but the proper data we couldn't get. And examination under anesthesia was not done, and long-term follow-up was not ensured. So in conclusion, I can tell that parents are compliant to treatment, and more endeavor we should go, and caregivers are efficient in our country, and we hope for a brighter future. Thank you, ladies and gentlemen.
Thank you, sir.
Thank you, Dr. Tariq, for a wonderful presentation. One question, sir. So how do you, where do you inject? And
The whole journey I put only 1 injection in NICU, but because that patient was in ventilation and I couldn't take it to the OR. So my experience is only 1 case, but even though we made this operation theater very clean and we didn't allow any other baby in that room, and then we put with all aseptic precaution, that is one.
So that means it can be done if required. We should not deny treatment.
Yes, we should not deny, but this is not a usual practice.
A very nice information and task you have done. But if we say that the dropout case in case of an anti-VEGF group, it was approximately 30, you can say 30% just came at 16th week, means 70% dropout. See, with the problem, you can say with the anti-VEGF is, if we are giving, then we are bound to have that, to do that checkup and laser after 4 weeks or so. And it was the main time when the dropping is highest in your group. So don't you think that it's better to laser these patients, or see, if the patient is not able to come out after the injection, then it's a drastic thing. It may result in, you can say, drastic complications. So
yes.
Whenever we are giving injection, we are making sure that the patient will have to come. They have to inform that if you are not able to come, or you may drop as per you are from far away, then better to have that laser.
Yes, so you are very correct, and that is very much important. You see, that I have told that after 3 months, we are not following that babies in very frequently. We have to increase this follow-up. And you see, if I did the FFA, probably these babies whom we told that that is blood vessels have grown up to a periphery, probably we can see that some new vessels are there. Probably we have missed those cases, and we have to follow those babies after going back.
Another thing which you can mix and match is that you do the Avastin or ranibizumab, and you laser the baby after 3rd day or a 4th day. At least we are a little bit safe. We are little bit safe. The extreme periphery you can do the laser after third day or fourth day or maybe after 1 week, because at that time your follow-up is good. So better to leave them anti-VEGF babies unlasered. Better we can
No,
laser
but I
at
think
some
1
point.
week would be too soon. We
too
can
early.
increase, because what we want the vessels to progress, and then we can laser.
Ideally, we should do
Because-
at third week or fourth week. But
Fourth
here
week.
the question is that they are dropping out.
No, if
So
they'll
we
come
don't-
at 1 week, they'll come at 4 weeks also. But you have to tell them, look, half of your treatment is done, half I'm going to do. I also have experienced the same thing. Only anti-VEGF do not work.
Yes.
You have to supplement with laser. But you have to tell the baby, look, I'm waiting for the vessels to grow, and ultimately you're going to need laser. I think so.
In
That should
our
be-
setup, in our cities, the follow-ups are definitely better. We are not losing any baby. And
Yeah,
in India, this is not a, you can say, a scenario right now. We are getting a, you can say, a good number.
Yeah, that is what I wanted to ask. Ma'am, you work in a place like Chandigarh, which has a big draining area from Himachal, Jammu. I've worked in Chandigarh for a few months.
Yeah.
So what is the compliance rate in a place like Chandigarh or Delhi? What is?
You know, if you tell the baby you're in hurry and you're saying, aapko aana hai, and you are counseling half-heartedly and your residents are doing
Yes.
it, they are bound not to come.
Yes.
But if you spend just 5 minutes with them, show them this is your vessels, they are like this, and now we are waiting for them to grow. They come back and then they say, hamari picture karni hai aapne.
Right.
They are very happy to see ki vessels puri grow kari ke nahi. So that kind of a thing. I think you just have to spend time with this, and we've had 100% compliance. There is no dropout. When we never had red camp, probably the dropouts were there because we were not showing them. Now they come and they.
So FFA helped Red
Not
Camp and
FFA, just the
Picture.
clinical picture helped.
Yeah, but see, the affordability is the issue. So what I do, that I always counsel the whole family. I don't counsel a single parent. I
has
always
to be
ask them
both
to
family.
come with your grandfather, grandmother,
that is important.
whatever they have in that house. I always call them and counsel them collectively.
Oh, that makes
good
a lot of
idea.
sense.
Yes.
Thank you.
Thank you.